but we're at the bedside. We need to be monitoring, assessing, and monitoring our patients. So for the nursing staff, it's making sure that we do assess for the presence of seizures, that we maintain the EEG monitoring system, and that we have providers who are going to be interpreting that. We would administer anti-convulsant medications as ordered by the provider, and then making sure we check the skin condition. Now, some of the challenges that many centers have is, despite recommendations to have EEG monitoring, maybe you have one in your hospital, or maybe you have 10 in your hospital. Maybe you have lots of EEG techs 24/7 and it's really not an issue. But for many places, it is an issue. As I said, we only have EEG techs in during the daytime. So what do you do with that cardiac arrest patient, or the seizure patient comes in and you have to assess their seizures at 10 o'clock at night? So when we look at, this is just a hypothetical model looking at financial cost of providing EEG, and that it's a big burden, right? A big financial burden. And when the times when people are looking at cutting expenses and costs, how do you make this most cost effective? So let's just say that you're at a hospital and you want to provide 24/7 coverage for an EEG tech, one EEG tech in-house, and that would cost an average salary $70,000 a year with some benefits, $294,000, and you buy 2 EEG machines. Now, this is a low ball figure. Our EEG systems were like $50,000 plus contracts for data storage, so it's a little bit more expensive than that. But you look at the conventional EEG 24/7 cost. Now, in our model, we have an EEG tech, 8 a.m. to 5 p.m. Let's say then you have a different system, maybe a rapid response EEG system, and there's the particular system I'm speaking about, this rapid response EEG system, has an artificial intelligence system built into it. It's called Clarity. There's a subscription price for that and for the headbands. And then when you look at the not having EEG overtime, tech overtime, and the ability to really deploy these EEGs rapidly, it can be a cost savings. And every hospital has their own model and their own number of techs. And I'm certainly not here to speak what happens at other hospitals or what your capabilities are. As I said, we are a non-academic center, and back in 2018, we had 3 continuous EEG machines and 6 continuous bedside CNS EEG machines for our ICU patients, and daytime tech. So what we did is we purchased 6 of these rapid response EEGs, and we went from an average wait time of, sometimes if you ordered an ER, I'll show you a slide, like 20 or some hours, 25 hours, to like 5 minutes. And we went from doing less than 100 a year to doing over 1,272 in the first 3 years of having that expanded EEG capability.